My talk was focused on discussing the culmination of 30 years of research which has delivered a new class of molecule called BH3 mimetics into the clinic. BH3 mimetics have come about because of many important discoveries, such as the discovery of the function of BCL2 as a molecule which sustained cell survival in 1988, then the discovery of the solution structure of a BCL2 family member, which led to the ability for medicinal chemists to create small molecules designed to specifically target that moiety. The first phase 1 study in acute myeloid leukemia with Venetoclax, the BCL2 inhibitor, was published in 2016. And today I was discussing some of the recent studies which have sought to improve the activity of Venetoclax in combination with low-dose chemotherapy and also hypomethylating agents. And I used my talk today to illustrate a couple of case studies. For example, one patient who had 4 very poor risk mutations in combination, including DNMT3A, IDH and FLT3, and normally, even with intensive chemotherapy, we would expect a particularly grim prognosis for such patients. This particular patient, who was treated with the combination of low-dose Ara-C and Venetoclax, remarkably achieved a complete molecular remission after 3 cycles of therapy. Even more interestingly, this 74-year-old patient continued through to 15 cycles of therapy and eventually, in molecular remission, had his therapy ceased and continues to be alive and in remission 1 year later. So I think this was an example of a fairly low-intensity regimen in combination with a novel molecule, Venetoclax, which somehow was able to specifically target the leukemic blast and possibly progenitors in this patient to produce a long and sustainable remission now after ceasing therapy. And I discussed the possibility that patients with nuclear phosmin-1 mutation might represent a particularly sensitive subgroup of patients with AML which might benefit from this regimen, and the future possibility that this combination therapy might even be applicable to younger and fitter patients with AML.